Hello, this is Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Thank you for taking the time to watch this video. Compassion Primary Care is an integrative practice treating individuals 18 and older in Brandon, Florida. At Compassion Primary Care, we treat you like a person, not a number. Patients are seen virtually or in the comfort of their homes. Today, I will be discussing insomnia. Unfortunately, insomnia is a problem that I know all too well. So, insomnia is the inability to fall, stay, or experience poor quality sleep. Over 1/3 of adults do not meet the recommended amount of sleep, which is 7 to 9 hours per night. Insomnia is the most common sleep disorder. Other types of sleep disorder include restless leg, obstructive sleep apnea, narcolepsy, etc. Insomnia can be either acute, typically lasts a few days, weeks, or months, and it can be due to schedule changes, life events, different stressors, or chronic, meaning it's present at least 3 days a week and for more than 3 months or longer. Sleep helps decrease the risk of chronic illness and accidents such as motor vehicle accidents and falls. It also promotes autophagy, which I have spoken with you about previously. In straightforward terms, autophagy is the body's ability to clear dead cellular debris. In addition to removing cellular waste, sleep helps to regulate our hormones. So ladies and gents, if you are premenopausal, menopausal, or experiencing andropause, you may have issues with sleep. Sleep helps us to consolidate our memories, it strengthens the immune system, and it maintains cardiovascular health. To state that not sleeping can harm your health is really an understatement. Insomnia can harm our bodies in the following ways. From a metabolic standpoint, it increases insulin resistance, which again increases our risk of diabetes, which I talked about diabetes in a previous post. It leads to impairment in growth hormone and muscle repair. Cardiovascular wise, it can increase the risk of high blood pressure and cardiac arrhythmias. Again, with our immune system, it increases the risk of infections and colds such as the flu, especially now that we're going into the flu season. That's very important. It reduces antibody production, and it even increases inflammatory cytokine production. Neurologically, it's linked to memory impairment. Psychological issues related to sleep include increased risk of depression, acute effects on mood, irritability, energy levels, and overall well-being. If you are having issues with sleep, the good news is you do not have to take certain pharmaceutical medications that can be habit-forming, addictive, or just plain old don't work. A proper physical and assessment is required to assess the possible causes of your insomnia. Possible causes of insomnia include circadian rhythm disruption, which is basically changes in your sleep-wake cycle. Poor sleep hygiene, so eating late, drinking large amounts of fluid, water later at night, a light from the TV, phone, and computer can all negatively impact our sleep. Stress. Many causes of stress exist, we know that. However, acute or chronic stress can lead to hypothalamus pituitary axis dysfunction, which again can negatively affect our sleep. Mood disorders such as anxiety, depression, or post-traumatic disorder can all affect our sleep negatively. Stimulants, caffeine, alcohol, nicotine, and even intense exercise can negatively impact our sleep. Underlying medical issues and even some medications can impact our sleep. Chronic pain, cancer, diabetes, asthma, hyperthyroidism, menopause, sleep apnea, GERD, which is gastrointestinal reflux disease, can all impact our sleep. medications that we commonly use to manage allergies or even nasal decongestions, beta blockers, which are often used to manage heart disease or high blood pressure, can deplete melatonin. Certain antidepressants, such as SSRIs, and even some diuretics, can deplete magnesium, which again can affect our sleep. And I actually just did a post recently discussing the benefits of magnesium. So some possible tests to address the root cause of sleep include, first, the gold standard, which is a sleep study. This test is used to diagnose obstructive sleep apnea, and it's actually done overnight. It can be done at your home or at a sleep center. Hormone testing. Hormone changes or fluctuations can affect our sleep. Cortisol and melatonin affect our sleep-wake cycle. In addition, insomnia is often experienced, as I said earlier, by those experiencing perimenopause, menopause, or andropause. Lastly, an overactive or underactive thyroid can also impact our sleep. Testing for these conditions can be done via urine, blood, or saliva to assess your hormones. Neurotransmitter testing. So neurotransmitters are chemicals in the brain that transmit signals between the brain and the nervous system. Testing is available to assess our neurotransmitters. Micronutrients. Deficiencies in things such as iron, magnesium, copper can impact our sleep. The gut microbiome. We continue to learn how the gut microbiome affects neurotransmitter production, which again affects that communication between the gut-brain axis. Evaluating for things such as diabetes or insulin resistance. Looking at urinary tract infections, which can also cause us to have issues with insomnia, more on the acute level, but still important to look at, etc. Now, 5 things that we can use to improve sleep include diet. Of course, I have to talk about diet. So what are we eating? A whole food diet is my recommendation. A diet that is high in processed foods and carbohydrates can lead to fluctuations in our blood sugar, especially at night, and this can cause us to wake up. Avoid stimulants such as nicotine and caffeine, especially later in the day. As we get older, it's harder for our body to metabolize and excrete these things. So if you do drink them, you want to drink them earlier in the day. Remember as well that caffeine is found in things such as coffee, tea, and even chocolate. Avoid alcohol before bed. Sleep hygiene habits. Have a set bedtime. Set a cool temperature in the bedroom. Avoid being overstimulated maybe 1 to 3 hours before bed. So that may mean turning off the TV, turning off your favorite program. Eat at least 2 to 3 hours before sleeping. Avoid blue lights, which come from our TV, our phone, or even our computer. Read a book, pray, and bathe with Epsom salt. This can all help us to relax and prepare for bed. About 1 to 2 hours before bedtime, start dimming the lights to help prepare your body to sleep. Exercise. Regular exercise, either in the morning or earlier in the day, is great and has many health benefits. However, as I said earlier, intense physical activity, especially closer to bedtime, can negatively impact our sleep. Counseling. If you've identified that there are certain stressors in your life, counseling, specifically biblical counseling, is something that I think is a great option and will encourage any of my patients to do. Supplements. There are various supplements that are available to help with sleep. I'm just going to go through them briefly. I'm not going to share dosage or time. If you want to know that, I would recommend you becoming a patient. So L-theanine, magnesium, melatonin, valerian root, lavender oil, phosphatidylserine, and various adaptogenic herbs, especially if you have issues with cortisol, can assist with sleep. Drinking teas such as chamomile, lemon balm, or even lavender tea can also be helpful in getting you to sleep. So today I have provided you with a broad overview of sleep. If you have insomnia, I would highly encourage you to speak with your primary care clinician about what was discussed today. I would also say that if you are taking any kind of pharmaceutical drug and you have been taking this for years, I would highly discourage you, again, I would highly discourage you from stopping that medication cold turkey because it can lead to some serious problems. So if you do want to get off, I would discuss that with your primary care about how you can responsibly wean yourself off that medication. If you are looking for a clinician who utilizes an integrative approach to address insomnia and many other chronic illnesses, or if you're just looking for someone to help you to stay healthy, please call or text us at 813-669-3084. Again, thank you for watching. Please like, share, and subscribe. I am Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Bye-bye.